Dr. Ruckman, you might want to stop sharing your
Yeah.
screen.
Okay. Okay. Yeah, that did take a little practice, didn't it? Hello, John.
Dr. Ruckman, is there a way for you to stop sharing your screen temporarily? Because we're seeing you and us.
Is that better?
That is better.
All right.
We are back to
Just
normal, and
getting
as soon as
familiar
you would
with
like
where
to
the
start,
buttons are. Yes.
as soon as you're ready to start, we have your quorum.
All right. Very good. Welcome. We're glad to have you here, and hopefully we're going to have some productive conversation about the pandemic and the issues surrounding it, especially those that the city council have directed to us. And so at this point, before we go any further, let's go ahead and take a look at our last minutes of our previous meeting and take a brief moment to read through those, and then we'll take a vote on that and move on. Okay. Everybody in agreement to accept the meeting notes from the last meeting?
I move approval.
In terms of, do you need to take roll on everything that we do in terms of voting, or how do we want to assume the
Well, I went ahead and I did, Dr. Morris motioned, Dr. Ruddy
okay.
seconded. And I'm recording just by what I can see who's on. So we are good using this method.
Okay, so in the future, you just let me know when you want something as far as a roll call. All right. Okay, let's go ahead and look at the agenda. First of all, discussion on the COVID-19 outbreak. Terry, Dr. Morris, I visited with him earlier, and he's got some information about the latest trends with the virus locally. And so, Terry, would you like to share some of that information?
Yeah, I don't see Dr. Nelson there, so let me show what I got. And am I sharing me?
Not yet.
Not yet. Okay, well, I must have not pushed the right button then. Let's see. Hmm. Not yet?
There we go.
Okay. Yeah, this is just basically the recent data. It's nothing that you don't probably already know. Average daily cases is down a little bit regionally, but the tests are also down. Our tests are more than half of what we've done in previous weeks. Our deaths and total weekly new deaths are down, but on the other side, average daily in the hospital is 730, and this is a rolling 7-day average, and that's up from 635 the week before. The numbers on ventilators is 86. That's up about 15 from what it was before. Average number of people in the ICU is It's up about 25. It was 148 before. And the average new daily admissions is up significantly. When you just carve out Eastern Jackson County, which is what I like to look at because we're just looking at the city, this is what our curve has been since April. That's where we are now, which is 179 new cases per day just from Eastern Jackson County. So it's Jackson County not counting Kansas City Mo. It's kind of depressing. This is the daily new hospitalizations. So from Eastern Jackson County, we're putting 34 a day in. And again, this is something that just continues to go up. This is statewide. New cases in the last 7 days, 27,000. We had 67 people die in the last 7 days. The positivity rate is still unreasonably high at 23.7%.
Dr. Morris,
Yep.
the slides I don't think are advancing because I see it off to the side, but I don't see it big on the screen.
Huh. I don't know. It's big on my screen.
I believe all the words you say. There we go. Now,
Oh, there.
Okay, so we'll just do it this way. So that's the original regional metrics for the 9-county Kansas City area. That's the daily new tests, which are down, and the weekly tests, which are down. This is the new hospitalizations, which is up significantly with 158. On the previous 7-day rolling average, ICU and ventilator rates are both up. We're not out of ventilators, but we're running out of nurses to run the ventilators, from what Daryl said. These are the numbers with the new cases. And again, this is just Eastern Jackson County, so Blue Springs, Independence, Buckner, Fleet Summit, et cetera. And as you can see, that was kind of our previous peak. This is where we are yesterday at 179 new cases per day diagnosed. These are the daily hospitalizations for just Eastern Jackson County. Yesterday, we were at 34 per day, which is just scary numbers. And then this is the update from today from the state. So we had 27,000 new cases, 67 deaths. They're in the last 7 days, so they're averaging 10 per day. Eastern Jackson County is averaging, interestingly enough, Jackson County is averaging a little over 1. Eastern Jackson County is averaging about 1. So that's kind of a funny number. And then this is our positivity rate for the entire state, which is just not a good thing. I'll let you have your show back here. Let me quit sharing. Back to normal. Okay.
Okay. Thanks, Terry. With those kind of numbers we're looking at, there's definitely some issues that we really need to keep monitoring. However, what we do about it is one of the concerns that most people have, and what are going to be the restrictions and how long and how significant are they going to be. So with this issue, it's not necessarily just the death rate, but that's the most significant thing. But like you said, Terry, Dr. Morris, the hospital staffing and ability to maintain their vigilance on these with this particular concern. We find hospitals not having enough staff. The people get tired, they get worn out, and the vigilance that's demanded is pretty significant. I can imagine working in a setting like that and being concerned all the time, because as a dentist, I would, I had to wear this kind of stuff all day, every day. And so I got used to it. However, it's not something that was any fun. But one thing that I knew is that it would protect myself, because that's what it is. It's personal protective equipment. And I had a healthy career. I missed about 5 days in those years. And so I personally can attest to the validity, I think, of the organization of masks and such. So, but masks alone don't do the job. It has to be in conjunction with hand washing and social distancing. But I personally think at this point, we need to be for particular points of interest for Mr. Steinmeier, the factors related to comprehensive community health, on the general economic and health impacts, future outlook of health limitations in the community, and broad community input for decision making. I'm not sure how we're going to go about, responding to all of these 4 points, and we may have to visit with him a little bit regarding some of what he was looking for in terms of the report and how he wants us to go about that. But at this point, do we have any ideas about how you want to deal with the questions that have been presented to us?
Okay, help me out. I don't think I saw those questions. Was that something that was mailed out?
So if you pull up the agenda for tonight,
Yeah.
There's under number 4, there's Councilmember Steinmeier's request to look at the following.
I must have missed that when it came across.
That's okay.
You guys go ahead and talk, and I'll look around here.
All right. And do we have any thoughts that anybody's got a burning desire to share?
Well, I will just start out and say there has been a suggestion that's been made that perhaps the board would like to present essentially their report on December 14th, which I know is kind of a short turnaround time. It's about a month away, but that is a study session night, and we only have one study session scheduled in December because of the holidays. But if there's anything that the board would like to report on these findings to Steinmeier, that possibly on that evening we could do, well, the board could do a report.
And
I assume
that would be, I think that definitely would be a possibility and something that we would consider. I would say that, I went back and watched the council meeting, and one of the points that Mr. Steinmeier brought to the table was having a voice at the table with the county. And I think that's an excellent point. And that I think that if we're looking at having better communication, the probability of having that the city council, buddy from the board that would be appointed to that responsibility of attending meetings that appropriate for the a staff member of some sort, whether on a board or whether from the city, to be involved in the communication. It's kind of like having our own board of health without having it right or in the office next to you, but you still have the responsibility and the opportunity to send somebody to the meetings that are designed to like we're doing right now, discussing the issues that are currently on the table.
Well, and I should, in the county's defense, I should share that, the region does have what's called the MACG, the Multi-Agency Coordinating Group, which does have multiple representatives. Well, it has a ton of representatives, but we always have one from the City of Independence on that group that's helping to discuss the larger picture of what's going on and where it's going as a region. So the city is not without a voice at the table for the region.
Okay.
There's a staff member who's there, and they do have multiple different subcommittees that branch off of that. larger group where the city has representation also. So although we may not always get to have our say on an executive order that comes out or something like that, it's not that the county hasn't been around the same table with us for these months, along with other jurisdictions and municipalities. So
Who's our staff member then that represents the city?
currently, I believe it is Jeff Hinkle, who they just switched out for the MACG. I believe Jeff Hinkle, who's one of our emergency preparedness people, is sitting on there. It was Dante Galinecki, for those who have met him. And he's still heavily involved. The mayor, of course, has a voice at the table. She's there for the MACG meetings. She always lends her voice, and she's one of those. If you ever get a chance to sit in and listen to one of the MACG meetings, I mean, she is vocal about speaking out for independence. So
what's the structure of that meeting? Is that everybody voices their opinion and then somebody who's in charge makes the decision anyway?
well,
or is it a
so
vote?
the purpose of the MACG is there's a broad representation, and with essentially so many core members that are sent there, I believe there's anywhere from a dozen to 20. Others are allowed to come. Mark, Mid-America Regional Council, staffs it, I guess you could say. They're the liaison for it. So they set up the meeting. They make sure all the meetings are there. They invite everybody to the table virtually. And they have the agenda to lead the conversation. And so the discussion is there. There's a lot of discussion. Sometimes there are lots of decisions made during one meeting. Sometimes it's a broad discussion of what's going on and where we should go, and assignments are handed out. So they'll essentially talk about RAPIO, which is the regional PIO group, the public information group. There's a school coordinator, the healthcare coalition, is there and represented. And so they're there, and they may then get assignments to send back to their subcommittees to work on things, and then come back with reports to the group so the group can make decisions. Now, ultimately, of course, the county is in charge of the county. Kansas City is in charge of Kansas City. So, I mean, if Mayor Lucas decides that he wants to do something, the MACG is not a governing body, although it may have many governing members. It's essentially a collaborative work group. So they may go off and decide to do their own thing, even though the group's decided something else. That's how it's set up to be.
So I didn't quite get who makes the decision.
Well, ultimately, that decision for an elected body, they're not a governing body. So if Frank White decides he wants to do something for Jackson County, Frank White makes that decision.
Gotcha.
They still have to go back to their elected officials, but that group is supposed to be there to help guide that conversation and make an informed decision, and hopefully bring some cohesion to what happens in the region, which doesn't always happen, and we know that. But that is the aim, is that we all move together as a group.
So, yeah, this is the first of this particular group and their status and what they do. With that in mind, then really mute that particular issue of having a seat at the table. Is there an aspect of this that needs to be included in terms of what the opportunities are, in terms of the ability to participate in actual decisions that than just advising? It sounds like they're pretty much just an advisory group.
They're supposed to be a coordinating group. I'm not going to say that sometimes it's not just advisory, but it's supposed to be coordinating so that the whole region works together. Now, to Steinmeier's request for broad community input, I'm not Steinmeier, so I can't interpret exactly what he's looking for there. I don't know if he wants more people to, if people were to be surveyed for what they want, if I don't know what he's considering broad community input. And I can't speak to what method he would like to see there.
Okay.
So these requests
go ahead.
from Councilman Steinmeier, are they directed to the advisory board? Because I'm not sure the advisory board is in a position to make recommendations on the general economic health of the city and the impact on businesses. That's not what most of us do. So
my understanding, and after this, I would encourage everybody who didn't get a chance to watch the video from the recording from Monday night to go back and watch it. Councilmember Steinmeier is just looking for essentially a broader discussion from the Board of Health on more than just, I guess you could say, the physical medical health issues around COVID, but a broader, more economic health, community health look at it is what he's requested.
Is that our charge? That doesn't seem to me to be in our job description here.
I mean, I'd be happy to go and do a presentation on the rationale for super spreader events. I've got a nice article here from MIT. They did a wonderful study that showed that 80% of infections probably come from 10% of individuals. And generally it's due to large gatherings. On average, a person with COVID will spread it to 3 other people. But if you do that at Thanksgiving, or I have a good friend who's a physician in Blue Springs. His brother-in-law came out of town for a birthday. There were 11 adults there and 5 children. All 11 adults got moderate to severe COVID, one of whom is still on a vent, and it's been 3 weeks now. So, most of the transmission of COVID is actually from rather large gatherings where you have 6 or 8 or 10 people. It's not necessarily you're going to get something at the grocery store, but I don't see any way that we can talk about economic impacts on a once in 100-year event that we don't fully understand yet. So.
Hey, Jason White here. I apologize. I'm at another event at this, so I'm just sort of got an ear to it, and I had a moment to engage. I agree with the other comments. We need to do what we're mandated and what the competency of the board is. I think we ought to take advantage if we're available to have maybe Dr. Morris is available to present the ongoing concerns that the board has with opening up prematurely the precautions that have been given us through the authority of Jackson County. I think meeting monthly to have an opportunity to hear an update and for folks to engage is the right thing to do, and that affords to the city the assurance to the city and the council that we're staying on top of the issue and we're ready to voice, hey, we like that or we don't like that. But I don't feel compelled to try to respond to questions that are not within the purview of the body. If they're looking for a comment, I'm an advocate. I agree with everybody saying some of the questions don't really fit us. And number 2, let's take advantage of the opportunity to engage with the council. They may have questions for Dr. Morris that they don't feel they're getting answered elsewhere, and he's so well studied on this. And number 3, if they're looking for another statement from the body, can we just reaffirm the motion from a month ago? I don't know. I haven't looked at it, so I don't know if it's quite up to date. But if they need a response, can we just something simple and direct? We're standing by what we've issued before, or we're recommending no change in public policy with regard to the COVID. Is there something we need to say formally as a board to respond back to be responsive. I mean, they have the right to ask us. I mean, we work for them, so I fully respect they've asked us some questions and we should do our best by them. So if that means we need to report and say, we've met, we've reevaluated the available information, and we see no reason for relaxing precautions at this time, then I'd be happy to make that motion. But I'm sort of looking for guidance as to how we do our diligence in responding to the request that's been made of us. I'll go back on mute.
Any thoughts or comments? Yeah,
But,
the idea that,
I'd support what Jason has said. If there's an opportunity to reinforce from a public health standpoint the need to stay the course and allow them to seek to talk to Dr. Morse. You've been voluntold, it sounds like, to this opportunity, but to talk to the board about the importance of the mitigation factors, the mask, the social distance, and all those things, and reinforce those concepts, I'm all for that. But the other questions, I'm not sure that's in our purview. So that'd be my point of view.
That's essentially where I'm coming from, but I can understand the economic impact that this is all having on our community and the world around us. And there is something to be said for, considering all of the issues, and it's a difficult conversation to have. And so, but it's not necessarily anything that I think we have any expertise on in terms of economic issues. And that's, as far as the experience of those on the board, I think it's more clinically oriented, and that's where our expertise lies, in my humble observation and opinion. Okay, so do we want to look at what kind of timetable or time frame were we given to put this together?
The only option that we truly have is the December 14th study session, which is about a month away. It's the only study session in December due to the holiday.
Okay.
I think I'm supposed to be in Switzerland skiing that weekend, but I can.
I don't think your passport's good to get there, because my passport's not good to get there.
Well, Doctor, do you have anything better that you can run by Christina?
No, and I'm happy to put some things together to kind of talk about community health and to talk about rationale for some of the decisions that are being made, and the future outlook of health limitations. I was watching something on TV the other day, and whoever it was saying, gee, I can't believe that COVID is as bad as it is now. And it's like, well, that's what everybody was telling you last May, was that come the holidays, we're not going to have enough beds. And it's a real, so unless somebody has a better magic 8-ball than I do, I'm not going to be able to say too much about what the health limitations are, but I can certainly say what it is that we're hoping for. I can address some vaccine issues. Someone was asking me the other day about when the vaccine is released, if it's released end of the year or beginning of the year, how well are we going to do? And I was talking to Ralph about that earlier, that if both of the two leading drug companies, Moderna and Pfizer, both get their okay, they each have 20 million doses. So that's 40 million doses, which means they'll be able to treat 20 million people. So they're going to start with the frontline health workers. And according to the U.S. government, there are 17 million frontline health workers. So that's the only people that are going to be treated. So we have no way of knowing what production's going to be like and what's going to be available to us in the future.
Can I add something? I was on a conference call with the Missouri and Kansas Nurses Association, and they said that there's so much vaccine that both of those companies need that vaccine moved out because they don't have enough storage space of their own because they're continuing to produce it.
Yeah.
So that was a very positive thing.
Okay. Well, Terry, do you want some help with the effort? Would you like somebody to bat around the ideas with, or would you just prefer to kind of do a rough draft and send it out to us and see if we have any input that we would like to share, or what's your thoughts?
Yeah, I may try to call Christina and talk to her a little bit about how to couch this. Like I said, I'm happy to talk about factual data that I have available to me, and that's a general consensus opinion rather than some new article that came out this morning, kind of a situation. And then at least with a couple weeks notice, I'll send everything out to everyone on the advisory board and have them look at the PowerPoint and kind of make a decision as far as, is this what represents them? Because I want to speak as a representative of the advisory board, not as myself. So,
Well, and for sunshine requirements, we may want to look at December 14th. I mean, there's time. We can try to see a rough draft or maybe some beginnings in time at the beginning of December for another board of directors meeting or a board of health meeting, and maybe look at that rough draft, then share it with the group, then get some marching orders to finish it up in time for the 14th.
Okay.
I got nowhere to
I
go.
think that sounds like a good game plan. Does that sound good to you, Terry?
Yeah, I'm still quarantined, so I'm not going anywhere. So.
Okay. Well, are there any other comments or questions or thoughts that anybody wants to share? All right. It sounds like we've got a game plan for the 1st of December to have a meeting just to get give you some feedback, Terry, and then we can go ahead and support you in presenting that to the city council in the next study session on December 14th. All right. Any other comments before we bring this meeting to a close? Okay.
I do have a question.
Go ahead.
This is a study session. I've never been bold enough to dial in this Channel 7 and watch study sessions. So what are they looking at? Just kind of a 4 or 5 minute presentation of this is what we're thinking?
Yeah. If you, I mean, normally what you want to shoot for, at least what I've always been told to shoot for in a study session, is something's about 5 to 10 minutes long. No more than 10 minutes long, because there will be other presentations that evening. I believe there's 3 others that are lined up. And so they'll want time to ask questions to couch in there. So you want to try to shoot for that time.
Got it.
Okay. Any other thoughts? Okay. I'm going to call this meeting adjourned, and Christina will get back in touch with us as far as any kind of time frame for a review meeting of the report that Dr. Morris puts together, and go from there. Thanks, Christina. Thanks, everybody.
Thank you.
Good night.
Night.